Sex differences in outcomes in cardiology are all the rage, deservedly so. We need to know whether there are differences when men or women present with certain symptoms or what the outcomes of various procedures may be in comparing sexes. Now in JAMA, researchers look at the issue of acute coronary syndromes and tried to figure out whether or not men and women presented differently with acute coronary syndromes. It is perhaps no surprise if I tell you the answer is yes, they do present differently, but the differences were not huge, nevertheless important. Turns out that women, perhaps surprisingly, presented with more non-ST segment elevation myocardial infarction, harder to diagnose anyway, than did men. Men had more ST segment elevation myocardial infarction. But the important difference is that women more frequently presented without chest pain and other symptoms, particularly tachycardia. But nonetheless, there were differences in presentation that are important, particularly in the emergency room in trying to figure out men versus women in acute coronary syndrome diagnosis. So the take-home messages here are very clear. Worry about the fact that women may not have as great a presentation with chest pain as do men, and that non-ST segment elevation is more common in women. So if you have a woman with funny symptoms that don't seem to work out exactly as you'd like to make a clear diagnosis, and you're worried about a non-ST segment myocardial infarction, make sure you work her up completely. For CardioSource, I'm Peter Block.